Over the last 2 years, we have seen the COVID-19 pandemic, the economic recession, rising inflation, and the rising hate and racism negatively impact South Asians in Canada. This makes CASSA's quest for social and racial justice and our work towards equitable outcomes for all South Asians even more demanding. The Council of Agencies Serving South Asians has worked on many initiatives to create social and systemic changes.
Funded by the Federal Department of Canadian Heritage, the Combating Online Hate Project developed materials to support service providers and racialized communities in addressing online hate. Studies show that around 1 in 5 Canadians have faced some form of online hate, with racialized folks facing it roughly 3 times more. Through this project, CASSA created a 60-page toolkit which covered 4 parts. Number 1, education around online hate. Number 2, actions to take when faced with online hate. Number 3, configuring your digital security. And number 4, accessing community supports and resources. CASSA and the Anti-Hate Community Leaders Group also led a 12-week national social media campaign that engaged over 20,000 people across Canada. The campaign included illustrations, infographics, and a training exercise with reflection questions called Reflect to Connect. An overwhelming majority of partners and toolkit users said the materials developed would be very helpful in tackling online hate.
The South Asian Vaccine Engagement Collaborative, also known as SAVIC, is a community-driven initiative made up of 12 organizations and funded by the City of Toronto. SAVIC works to develop agile, population-specific, and culturally responsive strategies to increase COVID-19 testing, vaccine confidence, and access among South Asian communities in Toronto. Our 40-plus ambassadors from SAVIC form the backbone of each initiative as they respond to community needs in real time. SAVIC's in-person campaigns include mobile and pop-up clinics, door-to-door outreach, and hosting information booths where South Asian gather. Online campaigns include town halls, webinars, workshops, and podcasts with COVID-19 and vaccine experts. SAVIC also trains all vaccine engagement teams in Toronto through culturally and linguistically responsive infographics, animations, poems, and illustrations that address misinformation and explore barriers faced by South Asians. All content can be found on CASSA's website. CASSA's 11th Annual Health Equity Summit was held virtually on July 14, 2022. This year's theme was Shifting and Sharing Power, with a focus on community engagement for reducing health inequities. We emphasize that community engagement is critical to understanding the unique circumstances facing communities living with health disparities. The summit strategized on having authentic and ongoing relationships with communities that experience marginalization through direct and meaningful involvement, beyond just one-time engagement events or client satisfaction. The 2022 summit featured 9 experts: Dr. Farah Mawani, Camille Ulrich, Dr. Jennifer Zelmer, Safia Ahmed, Amy Go, Anthony Galadu, Andrew Pinto, Dorothy Mary Sr., and Fatah Awal. The summit provided an opportunity for 120 public health professionals, community leaders, researchers, academics, students, social service providers, and decision makers alike to recognize and demonstrate meaningful community engagement as a core public health practice. A recorded version of the summit can be found on CASSA's YouTube channel.
Every May, CASSA celebrates the South Asian Heritage Month by highlighting the successes and innovations of South Asian Canadians through a poster campaign and a virtual forum. Each year, new champions are nominated to mobilize South Asian communities' voices and actions towards Canadian and global justice. We're creating spaces for conversations, learning and unlearning, and bridging gaps within and between communities. For 2021, CASSA addressed COVID-19 and the South Asian heroes that demonstrated incredible resilience and strength in supporting the victims of the pandemic. We had the honor of featuring Dolly Begum, Dr. Nahid Dasani, Dr. Samir Sinha, Fairuz Karim, Sukhmeet Singh Sachal, and Dr. Supriya Sharma. In 2002, CASSA discussed the topic of mental health and supports in South Asian communities and gave leaders the opportunity to draw from their perspective on mental health issues impacting the South Asian communities and their own lived experiences. We had the privilege of learning from Jasmeet Chagar, Maneet Shahal, Dr. Ripadaman Singh Minhas, Dr. Farouk Naeem, Dr. Farah Islam, Parvati Kandasamy, and Rita Colley.
The Coalition for Racial Equity in Education is in partnership with Urban Alliance on Race Relations and is funded by the Ontario Trillium Foundation. The project builds the capacity of Muslim-identifying high school students and parents with advocacy skills to have their voices heard in decision-making spaces and school boards. The goal for this project is to combat racism and Islamophobia in Ontario's education system through community capacity building and advocating for systemic changes in policies at school boards. From 2020 to 2022, CASSA worked directly with the Peel District School Board and Toronto District School Board to advocate for anti-Islamophobia board-wide strategy. We gained tremendous success in October 2021 when the Peel District School Board became the first school board in Canada to pass a motion to establish a comprehensive anti-Islamophobia strategy. TDSB is not there yet, but we are confident with the new trustees just elected to the board we can get this done. For the next 3 years, we will be continuing this project by popular demand, shifting our focus to York Region District School Board and Durham District School Board. We are currently recruiting parent and high school student volunteers from YRDSB and DDSB to work with us through the next phase of this campaign. Our training workshops for this cohort will start in December 2022.
CASSA's Hate Crime Reporting Project, funded by the Ontario Ministry of the Solicitor General, aims to facilitate a community-based approach to addressing hate-motivated crimes with Toronto Police, Peel Regional Police, York Regional Police, and Ottawa Police. In partnership with the Anti-Hate Community Leaders Group, this project looks to reconcile the different perspectives of what constitutes a hate crime, the best ways to report them, and how to approach investigations. Through our research in Peel, Toronto, York, and Ottawa, we are identifying ways to remove barriers to reporting for racialized and religious minority communities through training for police services on safe and anti-oppressive engagement practices. Also through this project, we aim to empower these communities with the knowledge to recognize hate crimes and safely report them. The goal of this project is to encourage systemic changes in police services through community feedback, which would increase public willingness to report and prevent future hate-motivated incidents.
The National Gender-Based Violence Project is a community-based research study funded by the Canadian Women's Foundation to understand GBV in South Asian Canadian communities during the pandemic. For this project, we have partnered with Progressive Intercultural Community Services in British Columbia, the Punjabi Community Health Services in Alberta, the South Asian Legal Clinic of Ontario, and the South Asian Women's Rights Organization in Ontario. We spoke with over 150 GBV survivors as well as many South Asian serving service providers to understand how GBV has changed during the pandemic, what supports have been required by survivors, best practices in successfully supporting clients, and feedback in improving services. Based on our data collection and feedback, we are creating an informative toolkit. During our dissemination phase in 2023, CASSA and its partners will be conducting training and workshops with service providers across the country and launching a national public awareness campaign.
CASSA has undertaken a second gender-based violence research project, with this one focusing on toxic and harmful masculinities and their impact on gender-based violence and intimate partner violence. This is a 3-year project funded by United Way Greater Toronto. CASSA has partnered with 6 community organizations for this project, including South Asian Legal Clinic of Ontario, Punjabi Community Health Services, Nisa Homes, IC Initiative, Bangladeshi Center and Community Services, and the Alliance for South Asian AIDS Prevention. Currently, CASSA and its partners are developing our research methods as well as recruiting participants for the research phase of the project. This project is a deliberate attempt to create space to engage in critical, meaningful, and effective conversations on toxic masculinity. These conversations are largely absent amongst South Asian communities and service providers. Through this project, we will build the capacity of CASSA's member agencies and others working in the field of gender-based violence to competently address the issue of toxic masculinity in cases of South Asian victims through culturally competent intervention strategies. The project will conclude in year 3 with a public awareness campaign encouraging intimate and family conversations on toxic masculinity in South Asian communities.
We'd like to thank our funders, partners, member agencies, volunteers, and our community members for supporting CASSA throughout this journey. To get involved, please visit our website.